Hello everyone, I'm Karolina, and this is the Endo Power Couple podcast. I came up with the idea of creating this podcast because I remember how hard it was to find good information about endometriosis and adenomyosis. From my own experience, I know that this illness doesn't just impact women, it also affects their partners, family, and friends. I try to create a podcast that takes a holistic approach to endometriosis and adenomyosis, so you can share it with others who say, "Endo what? It's impossible that it hurts you so much. You have a low pain tolerance. It's all in your head. Take this magical supplement, it will help." I hope this podcast will help sort out our thoughts about endometriosis and understand why dealing with this disease is so tough and comes with many challenges. I have to tell, I'm not a medical professional, psychologist or dietitian. Meanwhile, I have a little gift for you that I hope will make your endo appointment a bit easier. I want to mention that this is my first podcast ever, so please be gentle. Do you remember that moment in the doctor's office or simply in your room when you first came across the terms endometriosis or adenomyosis or even both? How many questions and lack of answers did you experience? I remember, and to this day, I can't imagine describing what endo is in just a few sentences. I can describe how endo works, gluing everything together and messing up my body, but it's not only that. Why? Because it's not just a condition of the reproductive organs, but also of the entire body, like muscles, joints, nerves, tendons, and inner organs. It simply affects our whole body without dividing it into separate organs. Did you know around 190 million women worldwide have endometriosis? The endometrium is like the inner lining of the uterus. Having these cells in the wrong spots messes with a woman's body setup, kicks off inflammation, and make chances of different health issue and autoimmune illness. That's why body make immune response, which sets off a series of specific reactions that disturb the usual functioning physiology of the body. When cells similar to those in the uterine lining go rush and spread beyond the uterus, it triggers a disease process resulting in endometrial anomalies. And when it's happened, these endocells cause inflammation, the body's way of responding to deviation like injury or infection. The inflammatory reaction in one part of our body spreads wave like to other anatomical areas. That's why endo brings along various health problems. That's why everything is so painful and make all endo symptoms in general. Not to mention anxiety and depression triggered by physiological changes and associated pain that often severely impact us. When I started writing and recording this podcast, I wasn't in the best emotional, mental, or physical shape. I know exactly how tough it can be. During the menstrual cycle, when an egg is released, the uterus gets ready for a potential baby. If that doesn't happen, we have a period. But for these rebels, cells outside the uterus, there is no way out. They follow a hormonal cycle each month, but without a way to leave the body. They just build up. Cells from the uterus sticks to organs close by, such as inner organs, bladder, ovaries, or fallopian tubes. Because monthly hormones make them grow and cause endometriosis to spread, the only way to stop it might be a surgery and later treatment. I remember when my pain was getting worse and I didn't understand why. It wasn't just hurting in my female organs, but I started having problems, for example, with my leg, the lesions inside the body, known as endo lesions, can affect the central nervous system. As these lesions grow, they need more blood and form stronger connections with nerves. When we have more nerve cells, it results in more signals being sent to the central nervous system. In practice, this increased activity in nerve receptors caused by the extra signals makes the nervous system more sensitive. When the nervous system receives a stimuli, receptors send signals back and forth, creating a loop where the number of signals exchanged increases, ultimately making the sensation of a pain stronger. What started as a little problem in one place now affects other parts, muscles and nerves all over. To put it simply, a small issue can lead to a very strong pain recreation. It's like organs talking to each other, and when one part has trouble, muscles automatically react and spread the problem. This exchange of info and the changes caused by inflammation bring along all endo symptoms. This often means a bunch of other conditions. For example, bladder pain, muscle pain around the pelvic area, messed up pelvic floor muscles, stomach discomfort, IBS, bacterial overgrowth in the gut, and nerves going crazy. All these problems make our body feel like it's in a real fire. And that's why this isn't just a disease of the female organs, it's a holistic illness. We understand that endometriosis lesions can appear in various places beyond the reproductive organs, such as lungs and diaphragm, inner organs. This shows that the condition is complex and can impact different parts of the body. The exact reason why cells from the uterine lining move outside the uterus is not fully known, but scientists believe certain genetic and environmental factors may increase the risk of developing endometriosis. I remember when a few years ago my endogynecologist advised me to avoid meat, grains, sugar, alcohol and processed food, basically almost 80% of what's in the store. Also, to stop consuming dairy, and indeed, when I stuck to this diet, I had good results. Now I want to tell you something about an amazing woman, Mary Lou Balweg. She co-founded a non-profit organization called Endometriosis Association in 1980. She reached out to women with endometriosis, asking for their own disease histories and the medical histories of the family members. Mary Lou Balweg has come to realize that endometriosis is an immune system disorder. For over 30 years, the database she created has been gathering information showing that close relatives of women with endometriosis, cousins, aunts, grandparents, and other relatives suffer from various allergies. Additionally, family interviews have revealed atopic disease, such as asthma, various types of cancers, heart disease, as well as autoimmune disease, lupus, multiple sclerosis, and diabetes. The information from Mary Lou Balweg database has also changed the long-standing theory that endometriosis mainly affects thin, nervous, perfectionist women in high-ranking positions, commonly referred to as a successful woman, who, as some magazines put it, postponed having children for later, or, God forbid, do not wish to become mothers at all. From the studies, it was clear that any woman can develop endometriosis regardless of her race, religion, skin color, career, or socio-economic status, period. It's worth mentioning that Balweg research suggests an increased risk of endometriosis in women whose relatives had autoimmune disease or allergies. As if that weren't enough, it's time to introduce a condition that could be named endo sister, adenomyosis. So, generally unpleasant symptoms associated with adenomyosis include very heavy menstrual flow debilitating lower back pain, and what patients describe as a feeling of heaviness and pressure in the pelvic area. In this sense, endometriosis and adenomyosis are like yin and yang. You can't talk about one without mentioning the other. Adenomyosis occurs when cells similar to those in the endometrium are situated within the smooth muscular lining of the uterus, known as the myometrium. In the majority of women with adenomyosis, endometriosis is also present, and both conditions share many common symptoms. Endometriosis patients do not necessarily have adenomyosis. I read that only 30% of women with endo will have adenomyosis. Unfortunately, I'm the lucky ones. Did you know endometriosis was first described by the German physician Karl von Rokitansky in 1860? The term endometriosis comes from the Greek words endon, meaning inside, and metra, meaning uterus. Adenomyosis was also described relatively early, around 1920s. Its name comes from the Greek word adenos, meaning gland, and mys, meaning muscle. As you can see, these conditions didn't suddenly become trendy. We will discuss detailed symptoms of the endometriosis and adenomyosis in the second episode. I wanna add, you can find us on Instagram, Endo Power Couple. Also, we have a freebie when you DM us on Instagram, Endo Power Couple. In the second episode, we're going to talk more about symptoms and debunk some myths. I hope you liked the first episode. Don't forget, visit our Instagram, Endo Power Couple, and DM us for freebie. And remember, knowledge empowers us, and together we can navigate the challenges and the doubts that arise because of these conditions. Until next episode, take care and keep advocating for your health and well-being. Stay tuned, Karolina.